Good day, everyone. Welcome back to my YouTube channel. This is Smart Media Facts. Here, I personally discuss about health and life. And today I'm going to be talking about acute bronchitis. In my previous video, I talked about bronchitis only. And we discussed about the two types of bronchitis. That we have the acute bronchitis and the chronic bronchitis. But today, we're going to be deliberating fully on acute bronchitis, the causes and the symptoms. But before we hit the nail at the head, if this is your first time joining my YouTube channel, I beg, do not forget to hit the subscription button and do not forget to turn on your notification bell so you don't miss out. And to my returnee, this is me saying thank you very much and welcome back to my YouTube channel. So like I said, we're going to be talking about the causes and symptoms of acute bronchitis. And first of all, what acute bronchitis is. Now, in my previous video, we talked about what this acute bronchitis is. That it is a short-term inflammation of the airway in the lungs, which is caused by the viral infections. Now, here lies the question. What causes this acute bronchitis? Since it is an inflammation, short-term inflammation of the airway in the lungs, what causes this acute bronchitis? Number one is bacteria. Bacteria like Chlamydia pneumonia and Mycoplasma pneumonia. These are the bacteria that causes this acute bronchitis. The second one is virus. Virus like rhinovirus. This is the common cold. We have the influenza, which is the flu, and also we have the adenovirus, we have the respiratory syncytial virus, and we have coronavirus. These are the viruses that causes this acute bronchitis. We have the third one, which is smoking of cigarettes and marijuana. We have the fourth one, toxins in the air. These are the four causes of this acute bronchitis. And when this arises, there are symptoms one should expect. There are symptoms that when you see them, you start suspecting this might be acute bronchitis. And remember, this is a short-term inflammation. Most times, this acute bronchitis doesn't require treatment. It comes and goes on its own. Now, here are the symptoms one can see and start suspecting or one with acute bronchitis might experience. The first one is runny nose and watery eye. Second one is fatigue. Third one, fever. Fourth one, shortness of breath. We have the fifth one, which is the last one, cough. And with this cough can come dry, firstly, and then starts to progress. When it progresses, it starts to bring up mucus. And most times, this mucus might change from white mucus to yellow or green mucus. We have to understand that it is normal. This is a sign that the immune system is really working, that the immune system is in good health. Because the immune system is trying to push out those blockage, that thing that caused the airway to be inflamed, those mucus to push it out. So it's a sign that the immune system is at work and that it is not infection of bacteria. Mind you, most times these symptoms can last up to weeks, while in some people this cough can last up to 1 month to 2 months. But please, when it lasts up to 1 month or 2 weeks, I will advise you to go see a healthcare practitioner, a healthcare giver, so that necessary diagnosis can take place. So this is all about this acute bronchitis. In my next video, we'll be talking about the chronic one. Let's get to understand about the chronic. We'll understand the acute, the causes, the symptoms, and how it works. So in my next video, we'll be talking about the chronic bronchitis. Do not forget to like, share, and to comment. And do not forget that this is Smart Media Facts, that here we talk about health and life. And to my next video, see you. I love you all. Bye.